Good afternoon, everyone. My name is Josh Houry. I'm the Community Relations Coordinator here at the Saskatchewan SPCA. I am pleased to welcome you on behalf of the One Health Education Committee. I would like to take a moment to acknowledge the land on which I live and work, and where I am situated today is Treaty 4 territory and homeland of the Métis. I would also like to tell you a little bit about the One Health Education Committee. This committee helps improve the quality of life of animals and humans by providing education for animal welfare and human service professionals. This four-part Zoonoses webinar series explores the complex relationship between animal diseases and public health. And zoonosis is an infectious disease that has jumped from a non-human animal to humans. Today's presentation will discuss important zoonoses in domestic dogs and cats and the relationship between companion animal diseases and public health. We do encourage you to submit your questions, and you can do so by using the Q&A feature at the bottom of your screen. If you hover your mouse down along the bottom of your Zoom window, you will see the Q&A feature. You can pop your questions in there. Dr. Sims has agreed to answer questions at the end of the presentation, so that is the best way for you to submit your questions, and we can make sure to get to them when Dr. Sims is through the presentation. And now I would like to introduce you to today's presenter. Dr. Erica Sims is the Animal Health Veterinarian with the Saskatchewan Ministry of Agriculture. Erica was born and raised in Saskatchewan. She completed her Doctor of Veterinary Medicine at the Western College of Veterinary Medicine in 2016 and went into companion animal practice in Regina following graduation. A strong interest in public health brought Erica back to the WCVM in the fall of 2019 to pursue a Master of Science in Epidemiology. Her research focused specifically on canine zoonosis and companion animal surveillance in the Prairie Provinces. Erica has strong interests in zoonotic and infectious diseases, disease outbreak investigation, and surveillance. She started as the Animal Health Veterinarian with the Ministry of Agriculture in March of 2022. In her new role, she primarily works on risk communication, disease surveillance, and animal welfare within the province of Saskatchewan. Welcome, Dr. Sims. Thanks for being here today.
Awesome. Thanks so much. Thanks for that introduction, and thanks for having me. I'm really excited to be talking about this topic today. So the title of my presentation is Companion Animal Zoonoses, where Animal Health and Public Health Intersect. And I do believe we probably have a pretty diverse group of people joining the call today. So this is going to be a relatively general and broad overview, but I'm hoping that everyone can walk away with something from this discussion. For the purposes of today as well, when I'm talking about companion animal zoonoses, Josh mentioned this, but I'm going to be focusing specifically on domestic dogs and cats. So horses, exotic pets, things like birds, reptiles, or small mammals. While there are zoonoses that we need to think about from this group of animals as well, that's a standalone topic on its own. So for today's purposes, when I say companion animal, I'm talking specifically about cats and dogs. And just to echo what Josh has already done, I wanted to do a land acknowledgement myself. So I'm calling from Regina. I acknowledge that I am on Treaty 4 territory, the original lands of the Cree, Ojibwe, Saulteaux, Dakota, Nakota, Lakota, and Métis people. I pay my respect to the Indigenous and Métis ancestors of this place and reaffirm our relationship with one another in the spirit of reconciliation and collaboration. Okay, so just a bit of an outline about what we're going to be talking about today. So to start, we're going to look at, well, what are zoonoses and why should we care about them? We're going to look at the human-animal bond, One Health, effects on the immunocompromised and underserved communities. Before we dive into some specific examples, so from the domestic canine side, we'll look at echinococcus and salmonellosis. And then from domestic felines, we'll look at toxoplasmosis and ringworm as a couple of examples. We will also spend a little bit of time looking at rabies, which can affect both domestic dogs and domestic cats, before we wrap up with prevention and biosecurity measures, things like vaccinations, dewormer, personal protective equipment, and cleaning and disinfection. So before we get into specific examples of domestic canine and feline zoonoses, I want to provide you with some background information, starting with the basic question, well, what are zoonoses? So in general terms, zoonoses are diseases that can be transmitted from animals to people and vice versa. So that can be through direct transmission, like the skin, through inhalation or ingestion, or it can be done indirectly through things like vectors, fomites, and the environment, which we'll talk about in just a moment. But what I mean when I say this is the definition of zoonoses in general terms is that it is now widely accepted that zoonoses represent those diseases that pass naturally between humans and vertebrate animals in either direction. So previously, the term zoonoses was only used to describe diseases that could be passed from animals to people, and then reverse zoonoses were diseases that could be passed from people to animals in the other direction. Ultimately, it's not always going to be so black and white, and there are often debates in the scientific community on how we look at and classify some of these diseases or pathogens that cause these diseases as being truly zoonotic or not. For today's webinar, we're going to focus a bit more on companion animal examples that fall into the direct transmission category. But very quickly, I want to provide a bit of background on those indirect transmission routes because environmental contamination and transmission will also be involved in some of our examples that we'll go through today. So when I mentioned some indirect ways that zoonotic diseases can be transmitted from animals to people and vice versa, the first thing I mentioned was vector transmission. And this is a term we may not all be familiar with, so we'll break down what we mean exactly when we're talking about vectors from a disease perspective. So think of a vector as a vessel that can pass disease from one living thing to another. A vector is not typically otherwise affected by the disease that it carries, but it transmits the disease between vertebrates, so animals and people. And you may be familiar with the term vector-borne diseases, and these are diseases that are perpetuated by insect biological vectors like mosquitoes, ticks, and fleas that can carry diseases and spread them between animals, between animals and people, and also between people from person to person. With these biological vectors, although they are not harmed by the disease, they do usually play a role in terms of the disease life cycle, and often the pathogen replicates or evolves in some way in these types of vectors. Some examples of these vector-borne diseases that affect companion animals and people that you might be familiar with are diseases such as Lyme disease, which is transmitted by a specific species of tick, or West Nile virus, which is transmitted by mosquitoes. Leishmaniasis is a very serious disease transmitted from dogs to people by sandfly vectors and through bites by these flies in other parts of the world where this vector is quite prominent. Or something like tularemia is just one example of a flea-borne disease that can affect animals and people. And these are just a few instances of vector-borne diseases to think about where companion animals might be involved. These diseases are also going to be dependent on geographical location and climate, as well as socioeconomic factors, etc. Biological vectors differ from mechanical vectors or fomites, which may also be part of disease spread. So an example of a mechanical vector could be something like a housefly, where it physically carries the pathogen on its limbs, body, or mouth parts, but it's not otherwise involved in the life cycle of the pathogen. Or the surface of a fomite, such as the bottom of a shoe, a door handle, the top of a table that is contaminated with a pathogen, might act as a potential source of infection for animals and people, depending on that pathogen's ability to survive on surfaces. Fungal infections and certain parasites may use the environment as part of their life cycle, and this can play a role in the indirect transmission of diseases as well. So these indirect modes of transmission can be really interesting and quite complex, but for the purposes of today, we are going to look more closely at some companion animal examples where direct transmission and sometimes the environment are a big component of the zoonosis. But before we get into our specific examples, I want to talk about several reasons why we should care about companion animal zoonoses. And the first point I want to start with is that the human-animal bond is extremely important for the mental and physical well-being of many people. Yes, we're going to see that there are some disease risks with owning companion animals and being in close, intimate contact with them. However, there are also many benefits to the human-animal bond, and this is actually well documented in the literature. Companion animals, including but not limited to dogs and cats, have become an important part of modern human culture from a social and psychological standpoint. Studies have shown that caring for animals creates a sense of nurturing in people, and pets have become well-established members of the family that benefit all age groups. Children who are raised with pets have improved social skills and self-esteem, a sense of identity, and have increased empathy towards others. Pets have also been associated with improved physical health in people. This includes, but is not limited to, reduced stress levels, reduced risk of cardiovascular-related illness, and reduced risk of asthma, specifically when children are exposed to a pet within the first year of life. Additionally, companion animals can support humans in other ways. Working in therapy animals assist with both mental and physical needs. For example, studies show that the use of dogs during cancer treatment can aid in the patient's overall morale and attitude toward treatment. Dogs have also been utilized in therapy for autism spectrum disorder. In Inuit cultures in Canada, dogs are used for travel and hunting purposes and are an important part of the Inuit history and ancestry. So although several companion animal diseases can have an impact on human health and public health, addressing some of the public health risks surrounding companion animal zoonoses should not take away from the important benefits of owning a pet or interacting with some of these domestic animals. And just to give everybody an idea on popularity of pets within Canada, the statistics that came out of the Canadian Animal Health Institute in September of 2022 showed that numbers have increased in recent years to approximately 7.9 million dogs and 8.5 million cats in Canada, and that 60% of households owned at least one dog or cat. So I think these figures do show that cats and dogs have become an integral and important part of Canadian society and our culture, and that this represents a large group of animals in our country that should be given some attention from the public health side as well. Which leads me into my next reason for why we should care about companion animal zoonoses. And it's because of a concept that is now popularly referred to as One Health, which is the foundation for this webinar series as well. But for those who maybe don't have the background or may not be super familiar with this idea, what exactly do we mean when we're talking about One Health? So in the simplest of terms, we'll use the definition from the World Health Organization, which defines One Health as an integrated, unifying approach to balance and optimize the health of people, animals, and the environment. And at the core of this definition, what this concept is trying to say is that we can no longer view diseases in silos. So human health, animal health, environmental health, and the health of our ecosystem are all inevitably connected. And we need to approach how we respond to disease events with a One Health lens. It also means that groups within each of these divisions, whether that be through government organizations, academia, industry, and other stakeholders, need to collaborate and communicate with each other on disease issues. So let's think of a disease-specific example where we have human health, animal health in both domestic and wild populations, and environmental components where dealing with a disease requires a One Health approach. And one that easily comes to mind is rabies, which we're also going to look at more closely today. So animal health is significantly affected by rabies because it's a fatal disease, and animals become a potential source for human infection through bites and scratches, which puts people at risk from the human health side. And the environment plays a role in this disease as well, because climate change is impacting the distribution of wild animals who might carry rabies, and therefore the distribution in areas of Canada where the disease may occur. And this is just one example of a One Health, pardon me, this is just one One Health example of several. The vector-borne disease examples we discussed earlier are also examples where it is easy to see how animal health, human health, and environmental health are impacted and involved, especially when climate change is impacting the distribution of biological vectors. Moving on to the next reason why we should care about companion animal zoonoses is that the public health implications that can arise from diseases of domestic dogs and cats is especially important for those individuals who are immunocompromised. And these people are at an increased risk of not only contracting companion animal zoonoses, but being significantly impacted by these diseases. And it includes children, the elderly, pregnant people, individuals on immunosuppressive medications, and those with diseases that affect the immune system. But there are definitely some gaps when we look at companion animal zoonotic risk in the immunocompromised. So studies show that physicians do not regularly ask patients about pet ownership or discuss zoonotic disease risk. There is also a lack of communication between veterinarians and clients in terms of immunosuppression and increased zoonotic disease risk from companion animals and pets. This could be related to the comfort level of what owners are and are not willing to share with their veterinarian. Less than 1% of HIV positive individuals reported receiving information from their veterinarian on dog ownership and zoonotic diseases in a 2002 study. So client education from veterinarians and human physicians, as well as better communication between the two professions, using that One Health lens again, is going to be really important in addressing the risk of companion animal zoonoses in immunocompromised individuals. Those who are immunocompromised can definitely still benefit from owning and interacting with animals, as we've already seen in our discussion on the human-animal bond. And the mental health benefits have been established in studies on HIV patients and newly diagnosed cancer patients. But there are several recommendations that can be adopted by immunocompromised individuals looking to own a dog or cat, or any individual who may be in regular contact with dogs and cats, which include improved hygienic practices, acquiring an animal greater than 6 months of age, feeding appropriately cooked diets, avoiding bites and scratches, as well as keeping the dog or cat up to date on vaccinations and parasitic control. And we will be discussing all of these preventative measures and best biosecurity practices throughout today's presentation and in more detail towards the end of the presentation. I did just want to mention this study, which was of particular interest to me when I was writing my thesis. And although it's on the older side now, I think it highlights some very important things and maybe some public misconceptions and lack of awareness surrounding companion animal zoonoses. So this study surveyed Ontario dog owners who enrolled their dogs in hospital and healthcare visitation programs and looked at hospital requirements for admittance of dogs into these programs. 91 individuals and 231 hospitals participated in this study. And the results that came out of this were 79% of owners revealed their dogs were allowed to lick patients' faces, 73% allowed their dogs to be on patients' beds, despite 89% of participants indicating that they had told their veterinarian of their dog's enrollment in a hospital visitation program. Only 14% reported any conversations with their veterinarian on zoonotic disease risk. When asked to name 2 diseases that people can catch from dogs, 40% of participants could not answer the question. There were 25 owners who could identify one pathogen, with rabies being the most common answer. Only 40% of hospitals who participated in this study expressed interest in free testing of all dogs included in visitation programs. The most common requirement from hospitals for inclusion of a dog in the program was proof of current core vaccination status, and only 2 owners reported that deworming was necessary to be admitted into the hospitals they visited. And when we get into some of our dog-specific examples, you're going to see why I find lack of deworming as a requirement for a program like this to be a pretty big concern. This study did at least find that temperament testing and health certification from a veterinarian were commonly required, but of alarming concern, 36% of participants admitted to being permitted to wander hospital wards without any supervision from hospital staff. So I'm mentioning this study because I do think it reveals an overall lack of public awareness, including awareness from human health professionals, on the potential severity of companion animal zoonoses and public health implications in Canada, particularly for the immunocompromised, which is why I think it's great that we're chatting about it today. The final and very important reason I want to discuss why we should care about companion animal zoonoses is the public health impact in increased risk in underserved communities with minimal access to both veterinarian and human health services. Zoonotic disease risk from companion animals, particularly dogs, is higher in these communities for a number of reasons. But in the north, a large reason is the profound effects climate change has had on disease cycles, as well as an increased likelihood of free-roaming community dogs, which is a respected and common practice in these communities. But a large proportion of these dogs are younger, where the rate of parasitism tends to be quite high. And these dogs are often not on dewormer because of the limited access to veterinary services and prescription veterinary drugs. So when we put all of these factors together, these communities are faced with some pretty unique challenges. Studies from Saskatchewan have shown a high proportion of parasitic infections in members of an Indigenous community who did not directly own a dog, indicating environmental exposure from free-roaming community dogs as a source of canine zoonotic disease spread. And several studies have revealed a disproportionately higher rate of zoonotic parasitic infections in Indigenous peoples compared to the general population, which we'll go over some of these findings when we discuss echinococcosis in more detail. There are a number of factors that contribute to why communities are without access to veterinary services. So geographical location is often a huge barrier. Resources often do not allow for the delivery of preventatives or treatment aids, and there is an overall lack of training for personnel in these remote locations. Furthermore, community members may understandably disagree with Western methods, and socioeconomic factors create additional barriers. There's lack of infrastructure, support, and equity. So additional work and support are required to combat companion animal zoonotic pathogens and public health risks in Indigenous communities throughout Canada in a sensitive, thoughtful, and collaborative manner. So we have a long way to go in addressing these complex issues, but I think it's really important for us to talk about it and recognize this as an important public health concern. And I wanted to include this photo of the Western College of Veterinary Medicine's service learning group, and I'm actually pictured on the right-hand side of your screen there, where we are participating in a spay, neuter, and wellness mobile clinic for Isle La Crosse in northern Saskatchewan. And I've participated in these clinics for over 6 years now, where we provide services to La Ronge and now Isle La Crosse, 1 to 2 times per year. It's extremely important work, but it highlights the limited veterinary care that exists for a lot of these communities, and that often mobile clinics are the only means to receive basic veterinary care. And just to give you even more perspective, so in a far northern community like La Loche, the closest veterinary clinic is about 4 hours away by car. Lack of veterinary services for companion animal diseases and preventative measures is absolutely going to impact human health when it comes to zoonotic diseases. So now that we have some of the context and background on zoonoses and a basic understanding for why we should care about them from the companion animal context, there are some specific companion animal diseases I would like to talk about. There's obviously an extensive list of companion animal zoonoses, but I'm going to emphasize a few interesting ones here today that might be of particular relevance to some of the members of this group, especially in scenarios where you may be handling or dealing closely with companion animals. So we'll start with some examples from the domestic dog. And the first disease that I want to look at is echinococcosis. And this is a super interesting but also terrifying disease complex caused by a parasite that can be passed from dogs to people. So echinococcus species are zoonotic tapeworms that circulate in populations of herbivores, including certain species of livestock, and domestic and wild carnivore hosts. This parasite is endemic in several parts of Canada, including Saskatchewan, and there are 2 types. So there's Echinococcus granulosus. Some strains are referred to as Echinococcus canadensis, and these affect moose, caribou, elk, deer, sheep, and then wolves, coyotes, and domestic dogs. And then the second is Echinococcus multilocularis, which affects rodents and wild canids like wolves, coyotes, and foxes, and then domestic dogs and cats are spillover hosts. Life cycles of both Echinococcus granulosus and Echinococcus multilocularis are primarily maintained in wildlife. However, dogs can become infected with both types and act as a host for these parasites, which further contributes to transmission and the risk of human infection. Cats can become hosts for Echinococcus multilocularis. So I'll give domestic cats a little shout out here as well, even though we're focusing more on the dog right now. We just tend to see this parasite associated with dogs more commonly. Dogs and other carnivores become infected when they ingest infected carcasses, such as organs from moose or livestock, like sheep harboring infected cysts. Dogs then shed infected eggs into the environment, further perpetuating the disease for other species and can be a source of human infection. So let's look more closely at how this can affect people. And a few things to be aware of regarding this parasite. So Echinococcus tapeworm segments are microscopic, and they're not going to be detectable to the naked eye when they are passed in the feces, which is different from some other intestinal worms that are clearly visible in canine feces. So humans can become infected when they inadvertently ingest the parasitic eggs. We've already established that dogs and then cats, in the case of Echinococcus multilocularis, shed tapeworm segments with eggs in their feces. And as soon as this happens, these eggs are immediately infective and they're highly resistant in the environment, surviving for months to sometimes years. Dogs can directly transmit to humans from eggs on their mouth, their fur, or body, or humans are infected by the environmental contamination in a more indirect way. In humans, there are two forms of this disease, depending on the species of Echinococcus. So if a human is infected with Echinococcus granulosus, it causes a condition known as hydatid disease, which causes harmful, slow-growing cysts in the liver, lungs, and other organs that often go undetected for several years and can cause extensive damage to the organs involved. If a human is infected with Echinococcus multilocularis, it causes a condition known as alveolar echinococcosis. And this form of Echinococcus is particularly dangerous because it causes parasitic tumors in the liver, the lungs, the brain, and other organs, which can be fatal if left untreated. Because of how this parasite behaves in carnivores and dogs as a host, dogs do not develop cystic disease or the tumors when they eat an infected carcass. Instead, they harbor the adult worms in the intestinal tract, where they continue to shed infective eggs in their feces. However, if a dog ingests the infective eggs from the environment, they can also develop the cystic and tumors in the organs that is similarly occurring in humans and herbivores. This is why regular deworming in domestic dogs and cats, especially those who are going to be in contact with wildlife or livestock, is really important. And while Echinococcus species are particularly dangerous, there are several other parasites that can be passed from dogs and cats to people that we're not going to be able to touch on today. But as I've mentioned, we'll talk about preventatives such as dewormer in more detail toward the end of the presentation. But this is a simple and cost-effective tool we have to prevent the risk of disease spread from dogs to people and other animals. So just to try to simplify this as much as possible and to better understand what's kind of going on here when we talk about this particular parasite, I'm just going to get my laser pointer here. Okay, so this is sort of the most simplified version of this life cycle. So we've got an infective egg here in the environment that is ingested by one of our herbivore hosts. And what happens is they develop these cystic lesions or tumors in their organs, such as the liver. The dog is exposed to this, ingests this if it's in contact with an infected carcass, and then the dog becomes a host with the adult parasitic tapeworm in their intestinal tract. And then that's when the dog starts shedding these infective tapeworm segments with eggs back into the environment, where then human hosts and other animals are exposed here. And then I added in this extra pathway, right, that dogs can technically also be infected by these infective eggs in the environment as well. Okay. As promised, I do want to use Echinococcus as a specific example to just circle back to what Indigenous communities are faced with in our province and across Canada. So there is an old Canadian study from the 1950s that shed some light on this when it found that out of 141 human cases of cystic hydatid disease, so which remember is caused by Echinococcus granulosis, 139 of these were Indigenous people, which was 99% of cases. A more recent 2010 study found that 11% of Indigenous residents from a sample size of 106 individuals were seropositive for Echinococcus species in Saskatchewan, with exposure from environmental contamination from community dogs being a likely source of infection. And this was because when they also tested 155 fecal samples from domestic dogs in 3 neighborhoods within that community, they found a 6% positive rate using DNA testing in these samples. Environmental contamination was suspected as a source of infection for individuals who did not own a dog or were not in direct contact with dogs. So I think it's really important to acknowledge that echinococcal infections remain significantly higher in Indigenous communities when compared to the general population. Another important zoonosis from domestic dogs I want to talk about is salmonellosis, which means we also have to talk a bit about raw food diets. Salmonellosis is also a concern for any cats being fed a raw meat diet, but the raw food diet trend has been adopted more within the domestic canine community when compared to cats, so it tends to be more commonly associated with dogs. So salmonellosis is a gastrointestinal disease caused by the bacteria Salmonella, with Salmonella enterica being the most relevant type from domestic dogs. In dogs, the disease can present in a multitude of ways, including a chronic carrier state without any clinical signs, to acute and chronic diarrhea and severe inflammation of the intestines, to life-threatening septicemia, which is bacterial contamination of the bloodstream. It can be really difficult to diagnose this disease in dogs because finding the pathogen is complicated by that intermittent bacterial shedding in those chronic carrier cases, and because isolating the pathogen only once from a healthy animal doesn't actually prove infection. To further complicate matters, the use of antibiotics to treat asymptomatic carriers or patients with localized enteritis is controversial because it may actually increase the risk of chronic shedding and antibiotic resistance, and multi-drug resistance to salmonella is becoming an increasing and emerging concern. So this refers to superbacteria that no longer respond to certain types of antibiotics, and multi-drug resistant forms do not respond to several classes of antibiotics, which is a serious public health concern because it limits our options for treating the disease. Clinical salmonellosis, as well as fecal shedding of salmonella in companion animals, has been linked to feeding raw food diets. In contrast to heat-treated commercial dog food, raw food diets are more commonly culture positive for salmonella species as well as E. coli species. Similarly, pet treats like pig ears have been identified as a source of infection for pets. And as already mentioned, many animals are unfortunately asymptomatic carriers, so they shed the bacteria without showing evidence of the disease themselves. Shedding of salmonella by dogs and transmission to humans has been linked to illness in humans living in the same household with a shedding pet. And usually, the route of infection is fecal oral, so by people inadvertently ingesting the bacteria. It's not just about handling the raw food carefully from the public health perspective, but what I want to emphasize is that domestic dogs are also physically shedding this bacteria into the environment. And while cooking a raw food diet or using a prescription veterinary diet is the best way to prevent salmonellosis, I'm not here to start a raw food debate. So if an animal is on a raw food diet, these are some additional measures that should be taken to reduce the risk of transmission to people. So cooking the diet is absolutely a solution when handling raw food diets. Be sure to be appropriately washing your hands. Use dishes that can be cleaned adequately, so stainless steel or glass. Do not use plastic dishes. Pick up after pets immediately, and then take care when handling and disposing of feces, appropriate hand washing, etc. This is going to be, again, a higher risk to be immunocompromised. So immunocompromised owners or individuals should not handle raw food diets and should not own pets on raw food diets. And puppies should not be on a raw food diet. So dogs under 12 months of age shouldn't be fed these types of diets because they do not have a mature enough immune system at a young age to appropriately handle the bacteria. Because of their weak immune systems, they are also more likely to shed higher quantities of the bacteria. Okay, so those are a few specific canine examples, and I hope you find them as interesting as I do, but we'll shift gears a bit and look at a few domestic feline zoonoses that are also important for you to be aware of. The first one I want to talk about is toxoplasmosis, and this disease also relates back to our discussion about increased risks to the immunocompromised because this disease is particularly important for pregnant people. So what is toxoplasmosis? Toxoplasmosis is a zoonotic protozoal infection caused by Toxoplasma gondii that affects humans and animals across the globe. Domestic and wild cats act as a definitive host for this disease, and one single cat harboring this parasite, usually from ingesting an infected rodent or bird, can shed millions of infective oocysts in their feces, contaminating the surrounding environment. So this is of particular concern with free-roaming cats, where soil and water contamination is going to be quite high. And then from this environmental contamination, livestock, wildlife, small mammals, birds, and humans can become infected with toxoplasmosis. In these species, the parasite inhabits the muscles and other tissues with infective tissue cysts that can be present for life. Common methods of transmission to humans include ingestion of those infective oocysts that are shed by cats in the environment, particularly from that soil and water contamination, ingestion of infective tissue cysts through undercooked meat. So this can happen particularly with sheep and pig products, and then vertical transmission from an infected pregnant person to a fetus. Environmental contamination, particularly from contaminated soil, is the more likely source of human infection than direct contact with cats. And then just for interest, prevalence of toxoplasmosis in North America ranges from 10 to 30%, depending on the region. And we just don't have as much Canadian data available, but in the US, 500 to 5,000 newborns are diagnosed with congenital toxoplasmosis each year, and 30% of the total human population is infected globally. So let's talk about the symptoms of toxoplasmosis in people and about congenital toxoplasmosis and pregnancy. So in an infected adult, symptoms can really vary from no symptoms to flu-like symptoms to more serious symptoms such as encephalitis, hepatitis, pneumonia, blindness, particularly in the immunocompromised, and then those abortions and stillbirths, which we're going to talk about. So pregnant people are particularly vulnerable to infection because it poses a risk to the unborn baby, and pregnancy is a risk factor because progesterone, which is a hormone that is quite high during pregnancy, alters the immune system's response to infection. Risk of transmission to the fetus is only possible if the person becomes exposed and infected with Toxoplasma gondii during pregnancy, so prior infections with the parasite pose no harm to the fetus. Infection with Toxoplasma gondii during pregnancy can result in spontaneous abortions, stillbirths, hydrocephalus, which is water on the brain, blindness, with neurological and or physical deficits in the child. In newborns who survive, congenital toxoplasmosis has been linked to schizophrenia, epilepsy, and motor disorders. And severity of clinical outcomes in the fetus are directly correlated to gestational age. So the risk of vertical transmission is low in the first trimester, but severity of disease is quite high. And then with increasing gestational age, vertical transmission risk increases, but fetal disease outcomes are less severe. So you can see that in that first trimester, the chance of transmission is 5 to 10%, but severity of disease is high. In the second and third trimesters, transmission risk jumps up to 60 to 80% chance, but the severity of fetal disease is lower. Here are a few things to think about regarding prevention and control of toxoplasmosis during pregnancy. So hygienic lifestyle reduces risk of infection by 63%. Avoid eating raw or undercooked meat. Avoid raw fruits and vegetables. Wash them appropriately. Wear gloves while gardening. Avoid handling cat feces if pregnant. The litter should be disposed of daily by somebody else and properly, so destined for landfill. Keep owned cats indoors if possible. Avoid traveling to prevalent regions while pregnant. Abnormal ultrasound is the best test to prompt additional testing in North America. And just to note that limiting risk of transmission to a fetus is easier than treating the disease once it is established. The next feline zoonosis I want to talk about is ringworm. Although cats are not the only type of animal that can be infected with ringworm, they are a species of animal we do commonly see it in though. And contrary to the name ringworm, this is actually a fungal disease, and there are several species of fungi called dermatophytes that can cause ringworm. And humans can be infected through direct contact with skin lesions from an infected animal, but contact with lesions does not always result in disease in humans, and I can actually attest to that from personal experience. When disease does occur in humans, it is typically mild, but it can be worse in the immunocompromised. And even though it's a less severe disease compared to some of the other examples that I've mentioned today, we do see it enough that I think it's important for you to be aware of, especially if you work with an organization that deals with high numbers of cats or kittens. In cats and other animals, clinical disease is more common in young animals who are stressed, such as those living in crowded environments. Clinical signs in cats can include hair loss, scaling, crusting, erythema or redness, papules or raised bumps, hyperpigmentation, and scratching or itching. Lesions can vary in appearance, but if you've not seen ringworm before, this is just an example of what it can look like. And in my experience, I find lesions tend to be around the eyes and the face in domestic cats. So you can see here a circular lesion. I find that in domestic animals, they very rarely look like a ring as they can in people. And there's hair loss, that hyperpigmentation and redness, and crust and scabbing. And we could probably presume that this cat pictured here may have also been scratching or itching. So moving away from the more species-specific zoonotic examples, the last disease I want to talk about quickly is rabies, which affects a number of animals, including domestic dogs and cats. And if you attend the next Zoonoses webinar session with Dr. Scott Weiss, I believe you're going to get exposed to additional information on rabies in Canada, but it is an important companion animal zoonosis that I need to mention here as well. And when we talk about diseases that can be transmitted from domestic animals and pets to people, rabies is probably the one that most people have at least heard of and are somewhat aware of. So rabies is a viral disease, and animals and people become infected with rabies most commonly by bites because the virus spreads through saliva from infected animals. But for your awareness, it can also be transmitted through scratches from an infected animal. Domestic animals are primarily at risk of exposure from infected wildlife, such as Arctic foxes, raccoons, skunks, and bats. And the reason rabies is such a serious public health threat is that once symptoms appear, there is no treatment, and the disease is fatal to all species, including humans. Signs in cats and dogs include hypersalivation, difficulties drinking and swallowing, aggression to people, but also to objects. They might have other acute behavioral changes, nervousness, be vocalizing, or they might be paralyzed and exhibiting other neurological signs. If an animal is exhibiting signs of rabies, like that hypersalivation, aggression, neurological signs, avoid unnecessary contact. If you must handle the animal, use protective equipment like work gloves and physical barriers to avoid being bitten or scratched, and seek veterinary assistance right away. If an animal dies suspiciously and there is a potential that it died from rabies, the animal should be sent for rabies testing through our Saskatchewan Provincial Rabies Response Program. And this is true for domestic animals, but wildlife can also be sent for testing. So within the Saskatchewan Rabies Response Program, this is the provincial contact information that everybody should be aware of for our province, with questions regarding concerns with rabies and guidance on testing. And if you want more information, you can also visit the Government of Saskatchewan website, but I can absolutely share this link and information with the facilitators to pass on as well. So private veterinarians across the province can collect samples from suspect animals and submit these for rabies testing under direction from the program's Rabies Risk Assessment Veterinarian. Test results are reported back to the submitting veterinarian and to the rabies risk assessment vet, who ensures that test results are distributed to everybody that needs to know the results. The rabies risk assessment vet also coordinates any response and follow-up activities in the event of a positive rabies test result. This is a coordinated response with the Ministry of Health and Public Health, who deal with the human side if there has been a rabies exposure. And if you are ever bitten by a domestic or wild animal with any signs of rabies, make sure you inform public health and seek their guidance immediately. And I've also popped up this public health number 811 for the province of Saskatchewan. So I talked about clinical signs to look for with rabies, but symptoms of rabies may not be as obvious as some might think, because they can look really similar to other neurological diseases. So I had wanted to show you a few videos of what this disease can look like in a dog as well as a cat, but the quality was just really slow on Zoom. So I'll share these links afterwards, and you can view it on your own time. But just be mindful that the content of these videos might be distressing to some individuals. And I'll also just warn that with the cat video, the cat is exhibiting signs of aggression towards a glove. Please do not do this in real life. I presume this glove does not have a hand knit and that it's for educational and demonstrative purposes only. But I've just marked down there at the 39-second mark for the dog example and the 50-second mark for the cat example. If you're interested, you can see what clinical signs of rabies might look like. That leads us nicely into our next segment, which is to talk about preventative measures that we can take to protect domestic animal health, which in turn also protects public health when we are thinking about companion animal zoonoses. So preventing some of the diseases we talked about today can be accomplished through vaccination, deworming, and flea and tick prevention. Vaccines, as well as prescription deworming and flea tick preventatives, can be accessed through a veterinary clinic and veterinary client-patient relationship, or VCPR. And I like to bring this up because people may not always be aware of this VCPR and what it means, which is that legally veterinarians cannot prescribe medication to pet owners without having this relationship and being aware of the health status of an animal through routine examination. So you should always get veterinary products from a reputable source and trust the expert in the field. Just as an example, over-the-counter dewormers, they're not going to target some of our more serious parasites like Echinococcus species, which needs a specific type of prescription medication called praziquantel. So please just always keep that in mind. As a reminder, I did want to list some of our vaccine preventable diseases in cats and dogs, and not all of these are zoonotic, but several of them are. I've marked those with an asterisk. And this is also about protecting animal health as well. So in dogs, distemper, adenovirus, parvovirus, parainfluenza, rabies, Bordetella bronchoseptica is our kennel cough vaccine. There is a Lyme disease vaccine and a vaccine for leptospirosis. And then in cats, herpes virus, calicivirus, panleukopenia, rabies, and feline leukemia. Luckily in Saskatchewan, we do not commonly see leptospirosis, but it is endemic in other regions of Canada. What does dewormer and ectoparasiticides treat in dogs and cats? So dewormer is going to treat those internal parasites, so species of roundworms, hookworms, whipworms, tapeworms, heartworm. Our ectoparasiticides treat those external parasites, so ticks, fleas, lice, mites, such as Demodex sarcoptes, which cause mange. And by the way, a lot of the companion animal parasites are going to be zoonotic. We also touched on vector-borne diseases earlier, so just emphasizing again that some of the ectoparasites dogs and cats carry, like fleas and ticks, can also be carriers for other diseases that can infect humans. I mentioned Lyme disease as a tick-borne example earlier, right? This is why regularly treating with dewormer and ectoparasiticides not only protects animal health, but it also protects public health and human health. And wrapping up here, what are some additional measures on top of using those preventatives like vaccination, deworming, and ectoparasiticides in our companion animals that we can take from the biosecurity perspective that can help protect us from companion animal diseases? It seems counterintuitive, but it's good to refresh our memory on some of these things. So if you work in the pet care industry, having vaccine or deworming requirements to receive services can be a really big one. Using that personal protective equipment, something as simple as disposable gloves, especially if you have an animal with skin lesions. Hand washing, hand washing, hand washing. Having dedicated spaces for people to eat and drink. So food and beverages should not be in those animal handling areas. And then cleaning and disinfecting appropriately. Always remove organic material first. Use disinfectants such as Prevail or 2% diluted bleach, but depending on the pathogen, there might be different recommendations for the type of disinfectant that you can use and contact time on the surface. So always check if you're not sure, consult with a veterinarian as well as with the product that you're using. Lastly, I do want to mention the codes of practice through the Canadian Veterinary Medical Association. So there is one for dogs and one for cats. And these also have great information on best sanitation practices, particularly in kennel and cattery operations. But the same concepts can be applied to anyone who may be handling cats and dogs. So I'll share this link with the facilitators as well to pass along. Okay, so that's it from me in terms of my presentation. Thanks again so much for inviting me to come chat with you guys today. I hope you were able to take something away from this discussion, and I think I went slightly longer than I meant to, but if there are any questions, I will happily take them now. I'm just going to stop sharing my screen so I can see you again.
Sure. So we do have a couple of questions. The first one pertains to the Saskatchewan study that you mentioned earlier in your presentation. And they are asking if they can get the... sorry, I lost the question. There we go. Would it be possible to get the citation for the Saskatchewan study?
Yes, absolutely. And I will happily share my slides too. So I'll make sure my references are all up to date here. And then if there's a specific one that somebody wanted highlighted, I can definitely share that. I would just have to go back and check and get the right one from my list.
For sure. Sounds good. And then the second question, and folks, if you do have questions, again, just a reminder, you can submit them through the Q&A feature at the bottom of your screen. And the question that we have here refers to a mention that you made of avoiding fruits and vegetables while pregnant to prevent toxoplasmosis. Would that include produce from a grocery store, or is that more directed to produce from our gardens?
So I guess potentially a combination of the two. Garden root vegetables is kind of our really big concern, especially in areas if there's free roaming cats in your neighborhood or depending where you live that could be contaminating the soil. You definitely would want to take care. If you're pregnant, wash them really well, cook them. I'm sure there are some additional measures when it comes to grocery produce, but just something to be mindful of for sure.
Perfect. And that actually answers all of the questions that have come in so far. We do have a couple of closing notes, so I will do one last call for questions. But while we wait, I will mention a couple of extra notes before the end of the webinar. You will notice popping up in the chat, there will be a link to a survey. If you could take a moment to answer that survey, that helps us plan future webinars for you. So please take a moment to do that. If you need a certificate of participation for CE credits, please send us an email. The email address is info@saskspca.ca. That will also be in the chat here. And you can get your your certificate that way. And then we also have a mailing list where we send out information about future webinars. That link is also in the chat there as well. If you want to sign up for that information, please do so. And we invite you to join us for the next session in the Zoonoses webinar series. Dr. Scott Weiss will discuss the important zoonoses and potential implications related to the importation of companion animals. This session will take place next Wednesday, November 16th at noon Saskatchewan time, and you can register for this webinar and all remaining webinars in the series at saskspca.ca/webinars. That link is also in the chat. And we do have a couple more questions that have come in. Are you okay answering them?
Yeah, for sure.
Okay, cool. The first one, actually, I can answer. It's just about a recording of the presentation. We will be uploading this presentation to our YouTube channel, and you will get an email from us to let you know when it is live and available for viewing in the next few days here. And then the next question that comes in asks, with the current shortage of veterinary services in northern communities and the related public health issues associated with the lack of access to veterinary care, how can we address this?
Yeah, and that's a really good question. I can see that coming in from Dawn. And I don't necessarily have an answer to that complex issue. The veterinary shortage is across our province. It's just some of these northern Indigenous communities have historically been affected by this for a long time, and the current veterinary shortage makes these things even worse. So, there are things kind of going on behind the scenes that we're trying to bring up and address, particularly when we use the One Health lens to get the attention of some of our decision makers. So I don't have an easy answer to solving the problem, but we're doing the best that we can to address some of these concerns, and it's going to be a long road and take a long time for sure.
Thank you. And then the last question that we have, how is zoonosis in companion animals trending? Are these issues being mitigated well in Canada?
Yeah, so this is a really great question. I'm glad this has come up. I didn't talk about it in today's presentation, but part of my research looked at, I'm just gonna move this, sorry, I'm getting like little flashes. Part of my research looked at the lack of surveillance data that we have on companion animal species in Canada, in Western Canada, and the prairies is kind of specifically where I looked. So we have surveillance where we look at disease trends over time for specific diseases in human health, in wildlife, in livestock diseases, but companion animals have kind of always historically been a group of animals where we don't keep track of certain diseases aside from rabies. There is surveillance for rabies. We have not been very good at keeping track of these diseases. So there is a new initiative that came out of the research that I did. It's being done through the Western College of Veterinary Medicine, through Tasha Epp, Dr. Tasha Epp's group. And it's the Companion Animal Surveillance Initiative, and it's currently in the enrollment phase, trying to get data and information on companion animal diseases that pose a public health risk. So a lot of these zoonotic diseases, where veterinary clinics can directly submit data so that we can start to gather some of this information over periods of time. A lot of the studies that we currently have are just snapshots of some of these diseases and pockets and areas, but it's not a continuous database of companion animal diseases. That's kind of in the works and in the early phases. But as we've also brought up, there's currently a veterinary shortage. So getting clinics to buy into some of these ideas and provide this information, they don't have the time to do it right now. So I think over the next couple of years, hopefully we'll start keeping track of and doing surveillance on some of these companion animal diseases that have that public health component. Like, I think echinococcus surveillance could be really important and really interesting, especially in some of our northern regions. So we just don't have the information right now. We don't keep track of that currently, but that's starting to evolve and change.
Very good information to have, I'm sure. Dr. Sims, that answers all of the questions that have been submitted. So with that, I would like to thank you for being with us today, and thank you for sharing your knowledge and insights with us.